Have you been looking for a natural way to treat an enlarged prostate without breaking the bank? In this video, we're going to share with you some of the vitamins that have been proven in clinical studies to reduce an enlarged prostate size. And the good news is, these are vitamins you can find in the food you can eat at home. But first, let's talk about the condition known as benign prostatic hyperplasia, or BPH. The prostate, a gland that's the size of a walnut and is located just below the bladder, actually has a pretty important job in the reproductive system. It produces fluid that helps move sperm along during ejaculation. And in layman's terms, an enlarged prostate is a prevalent condition affecting men as they age, which is why it's often seen in those aged 50 and above. When the prostate becomes enlarged, it puts pressure on the urethra, which is the tube that carries urine out of the body. This can cause various symptoms like trouble starting to pee, needing to pee often, not fully emptying the bladder, a weak urine stream, dribbling after peeing, and a higher risk of getting urinary tract infections. While an enlarged prostate isn't life-threatening, it can have a big impact on a man's quality of life. For instance, it can cause you to feel pain when you urinate. And we know peeing is a natural process we experience each day. Sadly, millions of men around the world suffer from this common problem. But the good news is that we have identified several key vitamins that can help shrink your prostate size naturally. Before we reveal what they are, keep in mind that this video is solely for information purposes only, not medical advice, since we're not medical professionals. You should consult your doctor if you have any medical concerns and before consuming any of these vitamins, especially if you have a known medical condition. Now, let's get to it. Number 1. Vitamin C, also known as ascorbic acid, is a valuable nutrient for managing BPH. This water-soluble vitamin is abundantly found in various fruits and vegetables like strawberries, broccoli, kiwi, oranges, and bell peppers. Vitamin C is really great for an enlarged prostate because it has these powerful anti-inflammatory properties. It helps reduce inflammation in the prostate gland, which happens a lot with BPH. Also, having an enlarged prostate is thought to be influenced by hormonal imbalances, especially when there's a rise in dihydrotestosterone, DHT levels. This hormone actually stimulates the growth of the prostate gland. Interestingly enough, vitamin C has been found to help regulate hormone levels and prevent the conversion of testosterone to DHT, which ultimately reduces the size of the prostate gland. Moreover, vitamin C is a powerful antioxidant that effectively fights off free radicals in the body. This means it helps protect cells from damage and reduces the risk of developing diseases like heart disease, cancer, and BPH. And by reducing oxidative stress in the body, this vitamin also plays a crucial role in preventing and managing BPH. Vitamin C is also super important for the synthesis of collagen, which is like a structural protein that supports and gives tissues its elasticity. And keeping collagen levels in check is said to be crucial in preventing prostate gland enlargement and making sure your prostate stays healthy. Simply put, vitamin C can really help manage BPH by balancing your hormones and ultimately shrinking your prostate gland. It's basically a must-have in your diet if you want to keep your prostate healthy and feel great overall. Research has even revealed that taking vitamin C as a supplement can actually act like a hormone. That is, it helps reduce the conversion of testosterone to DHT, which leads to a reduction in the size of an enlarged prostate. And in one study, men with BPH who took 500 milligrams of vitamin C daily for 6 months saw a significant improvement in their urinary symptoms compared to those who took a placebo. Another study even discovered that men with more vitamin C in their bloodstream had a lower risk of developing prostate cancer. Number 2. Vitamin B6. Vitamin B6, also known as pyridoxine, is a water-soluble vitamin that plays a vital role in our body. It's involved in important functions like producing neurotransmitters, dopamine and serotonin, metabolizing amino acids, and synthesizing hemoglobin. You can find this essential vitamin in a variety of foods like poultry, fish, avocados, bananas, potatoes, and fortified cereals. Research has shown that vitamin B6 can help reduce the size of an enlarged prostate and improve urinary symptoms in men with BPH. But how does it work? Well, vitamin B6 has these awesome anti-inflammatory properties that can help reduce swelling in the prostate, which in turn relieves pressure on the urethra and eases those pesky urinary symptoms. But that's not all. This vitamin also plays a key role in hormone regulation by converting tryptophan to niacin, which is essential for making sex hormones like estrogen and testosterone. And it's also involved in producing neurotransmitters like serotonin and dopamine, which help regulate the nervous system. So, by boosting nerve function, vitamin B6 has the potential to alleviate urinary symptoms associated with BPH. In fact, many studies have looked into the impact of vitamin B6 on BPH. In one study, researchers gave 200 men with BPH either a placebo or 50 milligrams of vitamin B6 every day for 12 weeks. And guess what? The guys who took vitamin B6 saw a big decrease in prostate size and felt some improvement when it came to their urinary symptoms compared to the placebo group. And get this, another study showed that men with BPH who took a combo of vitamin B6 and magnesium had smaller prostates and improved urinary symptoms than those who got a placebo. While vitamin B6 has been found effective in reducing an enlarged prostate and improving urinary symptoms, it's important to be cautious. Taking high doses of vitamin B6 can potentially cause harm. For men over 50, the recommended daily intake is 1.7 milligrams. Going over 100 milligrams per day can result in neurological symptoms like tingling in the feet and hands and numbness. So, it's best to be mindful of your intake. Number 3. Vitamin E. A fat-soluble vitamin, vitamin E plays a crucial role as an antioxidant within the body. It occurs naturally in a variety of foods, such as seeds, nuts, and green leafy vegetables. Vitamin E has been extensively studied for its potential to enhance prostate health and ease symptoms of BPH. As we mentioned earlier, inflammation is thought to contribute to the development of BPH. And guess what? Vitamin E is another vitamin that has anti-inflammatory properties that can be beneficial for men with enlarged prostates. By reducing inflammation, this vitamin may help slow down the growth of the prostate gland. In fact, a study published in the Journal of Urology found that men with BPH who took vitamin E supplements experienced a significant decrease in prostate inflammation compared to those who didn't. And since vitamin E is a powerful antioxidant, it means it helps protect cells from damage that's caused by free radicals. It can neutralize these harmful compounds, potentially slowing down the growth of the prostate gland and even preventing further growth and reversing enlargement. If you remember, hormonal imbalances, including high levels of testosterone, can also contribute to BPH. And vitamin E has shown promising results in regulating hormone levels, which means it could potentially reduce the risk or delay the advancement of BPH. Moreover, insufficient blood flow to the prostate gland can contribute to the development of BPH. Vitamin E has been found to improve blood flow, which may help alleviate symptoms associated with BPH. For adults, it's generally recommended to take around 15 milligrams of vitamin E daily. But hey, there might be situations where you might need higher doses. It'll depend on specific therapeutic reasons. Number 4. Vitamin D. This vitamin is super important for our bodies. Vitamin D helps keep our bones strong, boosts our immune system, and lowers the risk of chronic diseases. Plus, some new studies even show that it can have a big impact on prostate health by reducing the size of an enlarged prostate. Did you know that a study found a link between insufficient levels of vitamin D in men and a higher risk of developing prostate cancer? It turns out that vitamin D plays a crucial role in regulating the growth of prostate cells, which can help prevent prostate enlargement. But that's not all. Vitamin D also has anti-inflammatory properties that can actually reduce inflammation in the prostate gland and shrink an enlarged prostate. In fact, in one study, researchers discovered that men with BPH who took vitamin D supplements experienced a significant decrease in prostate size compared to those who didn't take the supplements. After thoroughly analyzing several studies on the effects of vitamin D on BPH, it's evident that vitamin D supplementation offers significant benefits. In particular, there were male participants who reported experiencing improvements in urinary function, particularly the symptoms associated with BPH and a decrease in prostate size. What's interesting is that the review also emphasized how safe and well-tolerated vitamin D supplementation was for the participants in these studies. The positive effects of vitamin D on an enlarged prostate are thought to be due to its ability to reduce inflammation in the prostate gland. This then helps shrink the prostate and alleviate the condition. Additionally, Vitamin D may help regulate the growth of prostate cells to prevent uncontrolled proliferation. That is, it stops those cells from multiplying abnormally, which leads to the enlargement of the prostate. To sum up, the evidence we have suggests that taking vitamin D supplements could be a safe and effective way to address BPH. It can help with urinary symptoms and may even prevent abnormal growth of prostate cells. You probably know that our bodies can naturally produce vitamin D when we're exposed to sunlight. But here's the thing. A lot of people don't get enough vitamin D from sunlight alone. And vitamin D production in our bodies can depend on factors like your skin tone, age, and where you live. So, to make sure you're getting enough of this important nutrient, you might want to consider a few things. First, try to have a diet that's rich in vitamin D. You can find it in foods like egg yolks, fatty fish like tuna and salmon, and fortified foods like cereal and milk. And if that's not enough, you can always think about taking a vitamin D supplement, which comes in both liquid and capsule form. Here are 2 more videos you may find interesting. If you enjoyed this video, give it a like and share the video with your friends. And for more interesting videos like this, subscribe to the channel.